Ladies and gentlemen, if you're over 70, I want you to listen very carefully, because the way you use your bathroom every single day could be quietly affecting your health, your comfort, and even your independence. Now, most seniors don't even realize they're making mistakes in such a simple daily routine, but these small habits, repeated day after day, can add up to bigger problems. And today, I'm going to walk you through 5 bathroom mistakes you must stop making, and 5 healthier habits to replace them with. Let's begin with the first mistake: straining too hard on the toilet. When seniors reach the age of 70 and beyond, one of the most overlooked but significant habits that affects daily health is straining too hard on the toilet. Many people don't even notice how much pressure they're putting on themselves in this routine act, because it becomes so automatic over the years. But straining is not as harmless as it seems. Every time a person bears down forcefully to move their bowels, the body experiences a sudden rise in blood pressure. For someone younger, this might not have dramatic effects right away, but for someone over 70, whose blood vessels may already be more fragile, this extra pressure can increase the risk of dangerous outcomes such as fainting, dizziness, or even contributing to heart and vascular stress. It is easy to dismiss this as a small detail, but seniors are often the most vulnerable to complications from what feels like an ordinary action. Another consequence of straining is the development or worsening of hemorrhoids. These swollen veins around the rectal area are not only uncomfortable, but can also cause pain, bleeding, and make future bowel movements even more difficult. The cycle becomes self-perpetuating. Constipation leads to straining, straining worsens hemorrhoids. Hemorrhoids cause more discomfort, and discomfort makes it harder to relax. What starts as a small issue becomes a long-term problem. For older adults, dealing with hemorrhoids is not only a matter of comfort, but also of maintaining mobility and confidence. Since the pain can affect their willingness to stay active or even leave the house, constipation itself is a major driver of straining, and this is often linked to lifestyle changes that come with aging. Medications, reduced activity, less dietary fiber, or not drinking enough water all contribute. Many seniors unintentionally set themselves up for harder stools, and then when they sit on the toilet, the only way to pass them is by forcing. The body is not designed to handle that kind of repeated strain at this stage of life. Over time, it can even contribute to conditions like rectal prolapse, where the rectum begins to slip out of place due to weakened muscles and repeated pressure. This is not only uncomfortable but may eventually require medical intervention. Such issues can be prevented or at least reduced if one simple change is made. Reducing straining in the first place, a healthier approach is to work with the body rather than against it. One effective adjustment is altering posture on the toilet. By raising the feet slightly on a small footstool, the knees come up into a more natural position that mimics a squatting posture. This simple change straightens out the rectal passage and makes elimination easier without the need to push so forcefully. The body is designed for this kind of posture, and many seniors find that using a footstool instantly reduces the amount of effort required. Breathing also plays a role. Instead of holding the breath and bearing down, taking slow, steady breaths and allowing the body to relax helps the muscles work more naturally. Relaxation is as important as position, because tense muscles make the process harder, while calm breathing signals the body to release more easily. Dietary and hydration habits also reduce the urge to strain. Seniors who consume more fiber through fruits, vegetables, and whole grains usually notice softer stools and easier movements. Drinking water consistently throughout the day keeps the digestive system moving smoothly, whereas dehydration hardens stools and forces more pushing. Gentle physical activity like walking supports bowel function by stimulating natural movement in the intestines. All of these supportive habits combine with the posture change to make bathroom visits safer and more comfortable. The goal is not only to avoid discomfort in the moment, but to protect long-term health by avoiding the complications that come with years of repeated strain. One of the most common habits among seniors over 70 is intentionally avoiding fluids, especially later in the day, in an effort to reduce nighttime bathroom trips. While it may seem logical to cut back on water to prevent frequent waking, this habit often does more harm than good. Ignoring hydration places stress on nearly every system in the body. The human body is made up largely of water, and even a mild level of dehydration can cause fatigue, dizziness, headaches, and confusion. For seniors who may already be dealing with medications, slower metabolism, and age-related changes, the effects of dehydration are magnified. A lack of sufficient fluid can increase the risk of urinary tract infections, constipation, kidney stones, and even cognitive decline. What might seem like a harmless effort to sleep longer can quietly lead to greater health challenges during the day. The bladder often becomes more sensitive with age, which is why nighttime urination, or nocturia, is common. In response, many seniors start drinking less water in the evening or cutting back throughout the day without realizing how critical hydration is. Dehydration thickens the blood, forces the kidneys to work harder, and can even impact heart health. This is why some seniors report feeling dizzy or lightheaded when standing up too quickly. In fact, studies have shown that older adults are more prone to falls when dehydrated, because the lack of fluids lowers blood pressure and affects balance. A single fall can have life-changing consequences, making proper hydration not just about comfort, but about independence and safety. Another overlooked aspect is how dehydration directly contributes to digestive problems. Without enough fluids, stools become harder and more difficult to pass, leading to straining on the toilet, hemorrhoids, or chronic constipation. This is a compounding problem. Avoiding water at night to reduce bathroom trips often leads to painful mornings in the bathroom. The discomfort caused by constipation then encourages more seniors to hold back on food or further reduce fluids, trapping them in a cycle that only worsens with time. On the other hand, consistent hydration supports smoother digestion, reduces the likelihood of straining, and makes daily routines less stressful. Cognitive health is also tied to hydration. The brain depends on a steady balance of water to function properly. Even mild dehydration can cause confusion, forgetfulness, and slower reaction times. For seniors, this may mimic symptoms of dementia or memory loss, when in fact the issue is simply insufficient fluid intake. Maintaining proper hydration improves alertness, energy, and even mood. Seniors who drink enough water often notice they feel more awake and less irritable during the day. This highlights how something as simple as water can influence overall quality of life and emotional well-being. The solution is not to overload the bladder at night, but to spread water intake evenly throughout the day. By sipping consistently in the morning and afternoon, the body gets what it needs without overwhelming the bladder before bedtime. Tapering off gently in the evening still allows for good hydration without triggering multiple nighttime awakenings. Choosing foods with high water content, such as fruits and vegetables, also helps. Herbal teas, clear soups, and even water. Rich snacks like cucumbers and watermelon provide hydration in a gentle way. It is about balance, not avoidance. Seniors who find a steady rhythm with their hydration patterns often sleep more comfortably, experience fewer digestive issues, and maintain clearer thinking during the day. Rushing through bathroom visits is a mistake many seniors make without realizing the toll it takes on their bodies. Over the age of 70, patience becomes even more important when it comes to daily routines, and the bathroom is no exception. Many older adults feel the urge to hurry, either because they do not want to inconvenience others, they feel pressure to be efficient, or they have grown accustomed to years of quick habits. But this sense of urgency can prevent the bladder from emptying fully. When urine remains behind, it increases the risk of urinary tract infections, which can be far more dangerous in older adults. Infections can spread quickly, affect kidney function, and in some cases even cause confusion or delirium. What may seem like saving a few minutes in the bathroom can quietly set up much bigger health problems later on. The bladder muscles naturally weaken with age, and rushing makes it even harder for them to do their job effectively. When someone forces themselves to finish quickly, the bladder may only partially empty. This incomplete emptying leads to frequent urges, discomfort, and a feeling of always needing to go again. Instead of saving time, it actually causes more interruptions throughout the day and night. Seniors may find themselves visiting the bathroom more often, disrupting sleep, or losing confidence when out in public, because they are never sure if they will need to go again. Slowing down allows the bladder to relax, the muscles to release fully, and the body to work at its natural pace. Another problem with rushing is the strain it places on the pelvic floor. These muscles play a critical role in supporting the bladder and bowels, and when they are not given time to function properly, they weaken over time. Seniors who push or rush too often may develop issues like urinary leakage, prolapse, or chronic pelvic discomfort. These conditions affect quality of life, making social situations more stressful and limiting activity levels. Taking time in the bathroom is not simply about comfort, but about preserving the strength and coordination of muscles that protect long-term independence. Rushing can also create anxiety around bathroom use. Seniors who worry about being too slow may try to speed through the process, which only makes them feel tense. That tension directly affects the bladder and bowels, because the body requires relaxation for elimination to occur naturally. Stress and rushing activate the nervous system in a way that works against release, making the process more difficult. This results in longer struggles, more frustration, and a greater chance of accidents. By giving themselves permission to take the time they need, seniors reduce stress, encourage relaxation, and improve their body's natural response. Practical strategies can make a difference. Sitting down comfortably, taking deep breaths, and allowing a few extra moments can support full emptying of the bladder. Some people find it helpful to lean forward slightly, place feet flat on the floor, and wait until the natural urge fully passes before standing up. Scheduling regular bathroom breaks, rather than waiting until the last moment, reduces the sense of urgency and minimizes rushing. In addition, staying mindful that a few extra minutes in the bathroom are far less costly than the health risks associated with rushing helps reinforce better habits. Seniors who allow themselves to move at a steady, unhurried pace protect their bladder health, reduce infections, and support better daily comfort. Many seniors believe that the cleaner they are, the healthier they will be, which often leads to the frequent use of harsh bathroom products. Over the age of 70, the skin becomes thinner, more delicate, and less able to recover from irritation. Strong soaps, disinfectant wipes, perfumed sprays, and antibacterial washes may create a temporary sense of freshness, but they strip away natural oils and disrupt the skin's protective barrier. This leaves older adults vulnerable to dryness, itching, rashes, and infections. What feels like a good hygiene habit can actually set the stage for more discomfort and health complications, especially when the sensitive areas of the body are exposed to chemicals and fragrances not designed for daily use. The bathroom is often filled with products marketed as extra clean or antibacterial, yet the human body is not meant to be scrubbed with such intensity every day. The skin has a natural balance of bacteria, many of which are beneficial. Overcleansing with harsh products destroys this balance, leaving behind dryness and irritation while also removing the protective microbiome that keeps harmful bacteria in check. For seniors, this imbalance can cause flare-ups of skin conditions like eczema, dermatitis, or fungal infections. These problems are not only uncomfortable, but can also take longer to heal in older adults due to slower cell turnover and reduced circulation. Instead of enhancing health, the overuse of strong cleansers works against it. Harsh bathroom products can also disrupt urinary and genital health. Many scented wipes, sprays, and soaps are heavily marketed as solutions for odor or cleanliness, but they often contain alcohols, parabens, or synthetic fragrances that irritate sensitive tissues. For seniors, This irritation can mimic the symptoms of infection or make existing issues worse. Women in particular, due to changes in hormones with age, may already experience increased sensitivity and dryness in the genital area, and strong cleansers only worsen these symptoms. Men can also face irritation and redness from overuse of perfumed products. What might start as a small itch can progress to painful irritation or recurrent infections that interfere with comfort and daily living. The reliance on chemical, heavy cleaning habits often comes from a fear of being unclean, but in reality, the body requires only mild care. Warm water and gentle, fragrance-free soap are typically enough to maintain hygiene without damaging the skin. Seniors who switch to softer, skin-friendly products often notice that dryness and irritation improve within days. Moisturizing after cleansing also helps restore the skin's natural barrier, preventing cracking and itching. This is especially important for areas like the hands, which are washed frequently, and the feet, which can easily develop dry skin that leads to infections if not properly cared for. Choosing creams or lotions without added fragrances supports healing rather than causing further irritation. The marketing of bathroom products can make it difficult to resist the idea that more foam, more fragrance, or stronger chemicals equal better cleanliness. However, for seniors, the focus should shift from stripping away to protecting and maintaining balance. Even household cleaners used in the bathroom can contribute to problems if they leave chemical residues on surfaces that come into contact with the skin. Non-slip mats, shower chairs, and towels should also be kept clean with gentle detergents, avoiding products that leave behind harsh residues. Small changes like these reduce unnecessary exposure and help the body's natural defenses remain strong. True hygiene is about supporting the body's natural systems rather than overwhelming them with harsh solutions that create more problems than they solve. Poor bathroom safety is one of the most overlooked risks for seniors over the age of 70. Yet it is one of the leading causes of accidents at home. The bathroom, with its hard surfaces, slippery floors, and confined spaces, can quickly turn from a place of routine into the scene of a serious fall. As people age, balance, coordination, and muscle strength naturally decline, making it more difficult to recover from even the smallest slip. Add water, soap, or dim lighting to the mix, and the risk of injury increases dramatically. A single fall in the bathroom can lead to broken bones, head injuries, or a long hospital stay. And in many cases, it reduces confidence and independence long after the physical injury heals. What seems like a simple trip to the bathroom can carry life-changing consequences if safety is not prioritized. One of the main hazards is the flooring. Bathrooms are often designed with smooth tiles that become dangerously slippery when wet. Seniors who walk in with socks or bare feet are especially vulnerable to losing their footing. Placing non-slip mats in the shower, bathtub, and near the sink is one of the simplest yet most effective ways to reduce this danger. Rugs or mats without proper grip can actually worsen the problem. So choosing products designed specifically to prevent slipping is essential. Wet floors should be wiped up immediately, and seniors should avoid rushing, as hurried movements increase the chance of slipping on unnoticed water. Lighting is another critical factor in bathroom safety. Many seniors try to avoid bright lights at night to protect their sleep, but dim bathrooms become hazardous in the dark. Poor lighting makes it difficult to see wet patches, small obstacles, or the edges of rugs. Installing nightlights, motion sensor lights, or brighter overhead bulbs ensures the space is clearly visible without disrupting rest. Adequate lighting around the toilet and shower areas provides extra reassurance and helps prevent disorientation. Especially for those who wake up groggy in the middle of the night, the layout and fixtures in the bathroom also play a major role. Grab bars near the toilet and inside the shower or bathtub provide stability when sitting down or standing up. Many seniors hesitate to install them, thinking they are unnecessary or unsightly, but they are proven to prevent falls and provide peace of mind. Raised toilet seats, shower chairs, and handheld shower heads further improve safety and comfort. These additions reduce strain, allow seniors to move more steadily, and help them conserve energy, lowering the risk of accidents caused by fatigue. A well-designed bathroom setup is not just for those with mobility issues. It benefits all older adults by creating a safer and more supportive environment. Footwear and clothing choices also influence bathroom safety. Slippers or shoes with good grip should be worn instead of socks or smooth. Bottomed footwear. Loose clothing that drags on the floor can catch and cause tripping, so choosing well. Fitting garments for nighttime bathroom visits helps prevent accident. Keeping toiletries and essentials within easy reach reduces stretching, bending, or twisting, which are common causes of imbalance. A clutter-free space ensures there are no unexpected obstacles in the path. Poor bathroom safety is often underestimated because the room is associated with routine and privacy rather than danger. Yet it remains one of the most hazardous places in the home for seniors. Taking practical steps to improve flooring, lighting, fixtures, and personal habits not only reduces the risk of injury, but also preserves independence, confidence, and peace of mind for older adults who want to continue living safely in their own homes together. These 5 small but powerful changes, avoiding straining, staying properly hydrated, taking unhurried bathroom visits, choosing gentle products, and creating a safer bathroom environment, form the foundation of better health and independence after 70. The bathroom may seem like an ordinary place, but the habits practiced there shape daily comfort, prevent serious risks, and preserve the quality of life. By paying attention to these details, seniors can protect their bodies, reduce unnecessary health problems, and continue to enjoy greater confidence and freedom in their everyday lives.